This study presents the transatlantic recommendations for prostate gland evaluation with magnetic resonance imaging after focal therapy for prostate cancer. The aim is to provide consensus recommendations on MRI acquisition, interpretation, and reporting after focal therapy by reviewing existing literature. To do this, the authors performed a systematic review of studies up to July 2022 to identify current practices and gaps in MRI use post-focal therapy. They then performed a 2-round consensus exercise with 23 panelists from Europe and North America to develop and score statements. The key findings and recommendations were, with regards to MRI timing, to perform the first surveillance MRI and PSA assessment at 12 months post-focal therapy to assess for recurrence, and if findings are normal, subsequent MRIs should be scheduled at 12-month intervals. With regards to MRI technical parameters, a full multiparametric MRI including T2, diffusion-weighted imaging, and dynamic contrast-enhanced sequences are mandatory, and MRIs can be performed with 1.5 or 3 Tesla scanners, with 3 Tesla being preferred. With regards to MRI interpretation within the ablation zone, the PIRAD score should be avoided. Indeed, lesions should be scored on an alternative 5-point scale, with DCE as the major sequence, with focal nodular strong early enhancement being the most suspicion finding, and diffusion-weighted imaging and T2 sequences as joint minor sequences. With regards to MRI interpretation outside the ablation zone, lesions should be scored using the PIRADS version 2.1 and Likert scores. Other general considerations are that MRI readers should have access to clinical details such as recent PSA values, kinetics, and Gleason scores to orient decision making. Moreover, MRI readers should have experience interpreting at least 20 prostate MRI examinations post-focal therapy annually. And finally, MRI reporting should be standardized. To conclude, the target consensus recommendations aim to standardize MRI post-focal therapy. Further research is needed to validate the recommended 5-point scoring system, integrate MRI findings with other diagnostic modalities such as PET-PSMA, and evaluate the correlation between MRI scores and long-term oncological outcomes. Now, despite these advancements, it is important to acknowledge the current lack of high-quality evidence supporting these recommendations.